All right. Let's see. Are we recording? We are. All right. Well, thank you everyone who is joining for our public comment session focused on the report associated with House Bill 23-1237. We are so grateful for your time and attention to this topic, and we're very excited to hear from you. So before I introduce myself, I want to have Andrea Stedman Seco, who will be interpreting this session today in Spanish, share a statement on language justice and how to listen to this session in Spanish as well as English today. So go ahead, Andrea.
Thank you. Good evening, everybody. My name is Andrea. I'm here with the Community Language Cooperative. Joining me is my colleague Gisela. And today we're going to be providing simultaneous interpretation in English and in Spanish and in American Sign Language so that we can practice language justice and everybody can communicate in the language of their heart or how they feel more comfortable. Once we turn on the interpretation, you're going to see a globe that is going to come up at the bottom of your screen. If you're on your phone or tablet, you're going to see 3 little dots or where it says more. Please make sure that you click there, either the globe or the 3 little dots, and select your preferred language. If you are bilingual, I apologize. If you're bilingual in English and in Spanish, you don't have to select the language, and you can always speak in whichever of those two you feel more comfortable. Please remember to speak at a conversational pace, remain muted when you're not speaking, and speak close to your microphone when it's your turn to speak. Hola a todos, mi nombre es Andrea, estoy aquí con mi colega Gisela y hoy estamos aquí porque vamos a practicar la justicia del lenguaje. Tendremos interpretación simultánea en inglés, en español y en lenguaje de señas americano. En algunos segundos vamos a aprender la interpretación y ustedes van a ver un globo que va a aparecer en la parte inferior de su pantalla donde van a poder seleccionar su idioma. Si están en su teléfono o en su tableta van a ver 3 punticos donde dice más y ahí van a poder seleccionarlo. Recuerden hablar un paso conversacional, mantenerse en silencio cuando no estén hablando y hablar muy cerca a su micrófono cuando sea su turno de hablar. Y si son bilingües en inglés y en español, pueden hablar en cualquiera de los dos y no tienen que seleccionar ningún idioma. Thank you, and we can begin interpretation now.
Okay, I just hit start. So if you want to go ahead and select your language preference, you can. And also I want to point out we have 2 American Sign Language interpreters here, and they will be switching off every 15 minutes or so. And if you would like to have them pinned, they should be spotlit, but if you want to pin, there's 3 dots next to their name or image, and you can go ahead and pin that on your personal computer. Additionally, I want to say in an effort to make this session as accessible as possible, please keep your video off and stay muted when you're not speaking. And we're going to ask that you limit the use of the chat as it can cause issues for screen readers. But you can send direct messages to myself or Mary or Melissa who are on here. And you can also share comments verbally or during our online session or through our online form. And I believe I already mentioned we're recording, but this recording will be available online next week. So my name is Carson McPherson Krutsky, and I'm a research associate at the Natural Hazards Center at the University of Colorado Boulder, and also the lead on this project. I am joined by 2 others who will introduce themselves in a moment. So the purpose of this session is really to share some of the findings of the report we recently created and gather feedback on the report focused on language and disability access for emergency alerts in Colorado. We plan to incorporate the feedback that's shared today and also in the earlier session that we had into the final draft of the report that will be due January 8th, 2024. So we're going to go ahead and start with some introductions, and then we'll provide a little bit of context on the bill. And then we'll go into the report and give an overview of the findings and recommendations. And then we'll have about 35 minutes or so to hear from you. And that's really the purpose of this session. So we hope you will join us in that. Oops. All right, so now we're going to go ahead and introduce the rest of our team members. So Mary, would you please start?
Hello, everyone. My name is Mary Angelica Painter, and I'm a research associate for the Natural Hazards Center. I am part of this team because I specialize in understanding social vulnerability, natural hazards, and government politics and policy. Thank you all for being here.
Thank you, Mary. Melissa?
Hi, everyone. My name is Melissa, and I am a research assistant at the Natural Hazard Center. My work broadly covers social vulnerability and vulnerable populations and disaster recovery. And I am a part of this team because my personal research in my dissertation research is on the recovery of Mexican immigrants. And language is a big part of that recovery. So I am happy to be here and on this team.
Thank you, Melissa. I now want to introduce Representative Elizabeth Velasco, who is the main bill sponsor for the bill that brought this research out. Elizabeth Velasco represents House District 57 in Western Colorado. She's the first Latina to represent the Western Slope and the first Mexican-born immigrant in the state legislature. Before getting elected, she ran an interpretation and translation agency for almost 10 years and became a wildland firefighter and public information officer. Language access and emergency response is one of her top priorities, and House Bill 23-1237 is the first step towards modernizing Colorado's emergency response to include multiple languages. Representative Velasco, go ahead. Thank you.
Thank you so much. I want to welcome everyone. Thank you for your feedback. Thank you for engaging in this conversation today. Very excited for all the work that is being done by the University of Colorado Boulder. And as you know, if you're in the language justice and accessibility space, we know that there's many barriers of access. And this bill is really about public safety. It's about making sure that everyone in our communities has access to emergency communications and are able to make the best decisions when there's an emergency. And this came because of my experience in my community where, we had a major fire where I-70 was closed for 2 weeks in a community that is 30% Latino, and we didn't have information in Spanish. So I really look forward to a more inclusive world, to a more inclusive system, and to hearing from y'all and your expertise in how we can make that a reality. So thank you so much.
Thank you, Representative Velasco. This is Carson speaking. All right, so I want to briefly introduce who the Natural Hazard Center is. We are a research center at the University of Colorado Boulder, and our goal is to build connections across centers or sectors, translate and share hazard research and information, advance interdisciplinary knowledge with an emphasis on engaging with socially marginalized populations, and mentor the next generation of hazards and disaster researchers. This is the first time that our center has been written into legislation, and we are so honored to be able to do this important work. As Representative Velasco discussed, some of the aims of this report were to assess the state of emergency alerts and warnings in Colorado, to identify gaps related to language and disability access, to identify best practices for inclusive emergency alerts and warnings, and provide actionable recommendations. So now I'm going to move into talking about our report. So I'm going to briefly go over the methods, findings, and recommendations that we included in this report, but I also want to reiterate that we really want to hear from you. So hopefully you've had a bit of a chance to review some of these materials in advance. Before I dive in, I want to say a quick note on some language that I will be using. So when I say the term emergency alerts, I'm referring to any notification, message, or warning that is intended to provide emergency information to individuals who are at risk. Additionally, I may use the words limited English proficient, which are populations who have difficulty comprehending and communicating in English. And according to the census, there are 250,000 people who fall in this category in Colorado, and almost 900,000 who speak a language other than English at home. Additionally, when I refer to disabilities, I'm talking about any condition of the body or mind that makes it more difficult for a person with this condition to do certain activities and interact with the world around them. In Colorado, there's about 1 million people who have some sort of disability. In this report, we do focus mostly on populations who are blind, deaf, deafblind, and hard of hearing as it relates to inclusive emergency alerting. All right, on to our methods. So we approach the objectives I spoke of earlier through 3 different ways. The first was a review of literature on language and disability access for alerting. So this included 62 documents to help us understand what are the barriers for alerting for people who have limited English proficiency and people with disabilities, and what are the best practices for inclusive alerting. The types of documents we reviewed were peer-reviewed articles, agency reports, news articles, and other relevant materials. If you're interested in seeing the documents included in this review, we have 2 annotated bibliographies, and we will share out links later on in the presentation, and I'll email that out afterwards. We also wanted to gather Colorado-specific information. So to do this, we conducted a survey of emergency response professionals. The survey was sent to 911 offices, emergency managers, sheriffs, public information officers, police officials, and fire officials through agency listservs. We were so excited that we received so many responses. We had 222 people who represented 57 out of the 64 counties in Colorado. We also held 18 partner meetings with 36 people from community groups, emergency management groups, alerting companies, and more. And these meetings really helped provide some additional context for the survey responses and really helped our team better understand the state of alerting in Colorado and some of the experiences that communities are having. So in the coming slides, I'm going to share our main findings as well as the recommendations. Now I'll go through our top 5 findings, but I'm going to dive into each one more specifically. So the first one is that there's a patchwork of alerting systems in Colorado. The second is that there's a high reliance on opt-in systems or systems that require people to sign up in order to receive an alert. The third is that emergency personnel need more resources to improve inclusive alerting practices. The fourth is that planning for language and disability access is inconsistent across the state. And the fifth was that there are technical and practical limitations that exist really for anyone in Colorado receiving emergency alerts. Now I'm going to go into detail on each of the findings. So the first one is focused on understanding that the alert systems and processes that exist in Colorado are very different depending on which location you're in. So this can hinder developing consistent and inclusive alerts. We discovered in our research that there was really no statewide standards that existed for alerting in Colorado. So each community is left to determine what kind of alerting software, what kinds of procedures, and which authority is going to be the one sending out emergency information. People we interviewed acknowledged that there were both positives and negatives to this approach. Not all communities in Colorado are the same, and so they are going to require different systems. For example, many communities have different language needs, and so approaches are going to have to be responsive to that. And a one-size-fits-all approach is not going to be reasonable for every community. However, we found that this fragmented nature of alerting can make it really hard for communities to share resources and also can limit access to alerts depending on the county that you're living in. We had an example shared where people were developing translated messages, but they couldn't share it across counties because of the software limitations didn't allow for the messaging to be shared. Despite there not being standards, the survey did show that there are 2 or 3 groups who are responsible for the majority of alerting in Colorado. These include emergency telephone service providers such as 911, which often is because they're staffed 24/7. There's also emergency management offices at 23.4%. I think I missed the percentage on the previous one. For 911, it was 33.8% of our respondents. For emergency management offices, it was 23.4%. And then sheriff's offices at 17% of respondents. This was followed by police departments, fire authorities, public information officers, and other. In the survey and in conversations, people shared that having a more shared system and practices for alerting would help improve the systems and provide more consistency, especially for the public who may not be aware of where to go for information because there's so many different agencies who are providing it. Excuse me. The second finding was that Colorado relies heavily on opt-in emergency alert systems, but most report that the opt-in rates are below 40%. These systems create barriers to everyone, but especially those who don't speak English or those who have disabilities, and it makes it more difficult to track alert subscribers and measure the efficacy of alerts. We had a survey respondent from Delta County say that most messages are being sent via opt-in systems through vendors such as Code Red, Everbridge, Genesis, etc. The success of these systems in an emergency relies on the community actively signing up for alerts. These opt-in systems include traditional alert vendors, as was mentioned in the quote, but also specialized providers that meet certain needs, such as ReachWell and DeafLink, which are services that provide alerts in other languages as well, including American Sign Language. And also social media, where people need to follow accounts in order to see information. And our survey showed that many emergency groups are using social media to push information out. Traditional alert vendors require people to sign up depending on their location. So if there's somebody working in one county and living in another county, they would have to sign up for multiple alert providers. Additionally, some of these systems require that people provide personal information, and this can be a barrier for people who have limited English proficiency, who may not be aware that they need to sign up, as well as the fact that they may not want to share personal information since they may distrust government agencies. We asked the survey respondents what their opt-in rates were for their main alerting vendors. And surprisingly, about 50% were unsure of their opt-in rates. For those that did know their opt-in rate, they shared that they were between 0 and 100%. We have a box plot here showing the range. The majority of opt-in rates, so the number of people subscribed within an alerting area, or percent of people subscribed in an alerting area, was between 17% and 54%, with the mean being about 38%. So the majority of people in communities are not signed up for alerts, which is an issue if that's how the alerts are being sent out. The emergency responders and personnel that we spoke with acknowledge that low opt-in rates limit the reach of alerts and that many people are unaware of the need to sign up. Tracking opt-in rates would help assess the effectiveness of outreach efforts and monitor the potential reach of systems in the future. We did also discover that there are alert systems that don't require people to sign up. These include the Wireless Emergency Alert System, or WEA, that sends alerts through cell phones and designated areas, as well as the Emergency Notification System, which sends messages through broadcast radios and television. But there are also limitations with these types of services as well. Sometimes there'll be bleed over in the location, so people outside of an alerting area will receive an alert that's not meant for them. So emergency managers are less likely to use it because of those issues. There's also limitations for language. So right now, American Sign Language is not compatible with these systems, and there's technical issues with some of them not allowing certain characters, such as tildes. And some of them are even limited to only 2 languages, so they don't even have options for including other languages. The Federal Communications Commission is working on expanding language access for these systems in the future, but it may be many years. So we found that more outreach is really needed to help populations with limited English proficiency and people with disabilities understand how current systems work and what they need to do to sign up. We found that many emergency response personnel are interested in incorporating systems and practices that would make alerts more inclusive, but They need more guidance, funds, and personnel to adequately update the systems and practices that they have. In interviews, some shared that just providing the basic services was a challenge without adding more systems and responsibilities. This was especially true in rural and underserved jurisdictions. A Gunnison County survey respondent said, "The reality is the expectations do not align with the reality of the capabilities of the software systems and personnel, particularly in rural jurisdictions." We asked what the main resource needs would be for alerting authorities to improve their systems and improve access, and we found that funding was the top need. Here we're showing a bar graph of the percent of respondents that answered for various resources. So the top need at 24% was funding, followed by personnel at 19%, and then training and technology at 18%, and then guidance on best practices at 17%, followed by access to technology, political support, and other. These findings suggest that without proper support, resource barriers will prevent inclusive practices from being adopted. The fourth finding was that implementation for language and disability access is varied and inconsistent across the state. There are some alerting authorities who are not aware of the options for making alerting more accessible, or they face issues with their existing systems. And as a result, they rely on practices that might not be meeting community needs. Others are making great strides and really trying to improve systems, but they also face challenges that they shared. For some jurisdictions, alert authorities reported a variety of methods for providing inclusive alerts, but others surveyed said they had significant limitations that really prevented them from reaching audiences they wanted to get alerting out to. We asked the survey respondents, does your agency offer multilingual alerts? And here we're showing a pie chart with their responses. So 53% said yes, 36% said unsure, 7% said no, and 3.6% said no, but we would like to. Among those who said yes, they had multilingual capabilities, the majority provided them in Spanish, followed by Chinese, Russian, German, and Vietnamese. However, given resource constraints, many shared that just having the capabilities to support multilingual alerts doesn't always mean that they're used. Because of the resource shortages that we mentioned, many rely on translation options that are available to them, but they may not be ideal. So more than half of the survey respondents reported using artificial intelligence services to translate messages, such as ChatGPT or Google Translate. These have previously led to improper translation that has caused confusion for the public and has the potential to create distrust of these systems. Despite advances in AI, best practices suggest that human interpreters should review emergency alert messages. There were a number of people who had multilingual staff to help with translation, about 20.5%, but they shared that having staff is not enough because these staff are not there 24/7. And emergencies can happen really quickly when information needs to get pushed out, and interpretation can also take a long time. So there's issues with providing translated information in a scenario where you only have a few minutes to push information out. One group was developing translated templates that I mentioned previously that they could use in advance that were able to be reviewed by translators before they went out. This reliance on non-ideal systems comes from a lack of resources and capacity. Respondents from the survey shared that the top 3 issues with providing translated emergency messages were delays in disseminating the message, inaccurate or confusing automated translations, as I mentioned, as well as low opt-in rates for alert systems that offer information in multiple languages and for people with disabilities. We also asked, does your agency offer alerts for people with disabilities? Here we're showing a pie chart again with the same types of responses. 41% said yes, 50% said unsure, 3% said no, and 5% said no, but they would like to. So when it comes to disability access, respondents, the majority, over 50%, were unclear if their systems provided opportunities for people with disabilities. And we also asked people to elaborate a little bit. So some shared that their systems provide information via text and phone and through a couple other systems that should be accessible for people who speak ASL. But we talked to the CEO of DeafLink, which is a group that provides accessible alerts. And they shared that because American Sign Language is not English, just providing English text is not enough to provide emergency communication. So that also speaks to potentially the issue of people not knowing what the needs of this community are. Respondents in our survey also noted that individuals have to make sure they are signed up properly to receive accessible alerts, and they may have to select additional things on their sign up, but many people may not be aware of that. Additionally, partners shared that traditional emergency response training does not typically include training on access and functional needs, but emergency managers and responders are really willing to adopt these practices, but they need more guidance and more support. The last finding was that there are technical and practical limitations of emergency alerts that hinder most people. They are compounded for challenges that are faced by those with disabilities and linguistic consideration. These include delays in technology upgrades, limited awareness of systems, and pushback from private industry, among others. So despite our team really focusing on language access and disability access and alerts, we discovered that there's a slew of other issues going on that makes it really challenging to get alerts out just to the public in general. So now I'm going to move on to our main recommendations, and each of these recommendations match up to multiple of the findings. And so we decided to categorize them into 3 main areas that include people, practices, and then data and funding. So under people, we recommend that Colorado hire state-level personnel to address language access needs. These personnel could focus on language access to ensure that there's consistent support for different municipalities' alerting efforts and making them more inclusive. Responsibilities could include assessing local needs, developing language access plans and resources, developing trainings, and promoting the adoption of inclusive practices across Colorado. These staff could coordinate with the existing Colorado Office of Emergency Management, Access and Functional Needs team. We also recommend that they develop formal relationships with limited English proficiency and disability populations and organizations that support those groups. It's really critical to establish trusting connections between emergency response agencies and community groups before emergencies. And also these connections can serve as a pathway to distribute information when emergencies are happening and to ensure that the information being provided is culturally appropriate. Actions under this goal could include developing steering committees, forming advisory councils, and hiring community champions or multilingual staff to provide feedback on these relationships. The second, and under practices, we have 2, which are standardizing alerting practices across the state. So a Gunnison County survey respondent shared that recognizing that each county is unique and has its own strengths and needs, there should be some baseline standards for emergency alerts in Colorado. And what we found was that there actually are really great examples of states having statewide systems. And so a next step from this research would be looking into those statewide systems to better understand how they're funded and how they work and how Colorado might adopt them. Developing more statewide standards would ensure consistent language and disability access and reduce barriers for local authorities. Some actions under this recommendation include standardizing who the alert vendor is that people are using, designating who the alerting authorities are, sharing inclusive access materials, as well as tracking opt-in systems across the different alert systems that are in use. The second is creating and distributing language and disability access resources, which also ties into our first recommendation under having staff. So under this one, people could provide more guidance, training, and shared resources for language and disability access across jurisdictions. Actions under this would be including and conducting regular trainings on cultural competency, community needs, technology options, and creating shared resources such as glossaries or translated templates. The final two recommendations are under data and funding. The study uncovered areas where there's really a need for more information. Our team really scratched the surface in terms of understanding inclusive alerting, and we would love to dive a bit deeper and also hear more from the communities themselves. I think in this study, we really had to focus on alert authorities and how information was being distributed, but we'd really like to gather some more information from communities and their understanding of opt-in alerting systems, whether they're using them, how they want information to be delivered, as well as helping understand what are the best practices for implementing some of the recommendations that we provided. The last one is securing funding to support inclusive alerts. We found that unfunded mandates are very unpopular across everyone we spoke with and are unlikely to address these findings. So funding really comes down to helping all of these recommendations. And I think that's somewhere that the person who could be hired could help with thinking about those funding resources. And we also developed a list of funding resources that could be looked into for federal funding that could support some updates to existing alerting. Additionally, given the capacity issues of communities, grant writing assistance may be needed to ensure that Colorado communities can access funds and use them to improve their systems. All right, so now we're going to move on to the comment portion. And since we have limited time today, we may not be able to hear from everyone, although this is a smaller group than before. So we hope to hear from as many as possible. But if you aren't able to submit a comment today, we will definitely be sharing our feedback form, and you can submit written feedback in English or in Spanish through that afterwards. So now I'm going to go ahead and turn it over to Mary, and she's going to facilitate the comment session of the meeting.
Hello, everyone. Thank you so much for joining us, and we are looking forward to hearing your comments. I have just a few points of order, I guess you could say, for the comment section. We would ask that you please introduce yourself before speaking. Because we have a large number of people, please try to keep your comments under 2 minutes. And if we have time, you're also more than welcome to speak more than once. We have on here on the slides that it says feel free to add comments to the chat. But we found out after we made these slides that it's best if you don't do that for those who use e-readers. So if you do have a comment that you'd rather have me read, you are more than welcome to send me a direct message. We are also wanting to let you know that this is not necessarily a questions and answers session, but we are more looking forward to hearing from you. So we were looking for your suggestions, any stories, or examples you have to improve our report. So we ask that you keep your questions at a minimum. And also, just as a reminder to everyone, since we are using both Spanish interpretation and ASL interpretation, just please speak one at a time and speak slowly. Please remain muted when you are not speaking. And please be sure to be as close to your microphone as you as is audibly possible so we can clearly hear you. And again, please identify yourself beforehand. So with that, I think we're ready to get started. Carson, am I missing anything else?
I just shared the prompts for discussion, so if people want to review those.
Oh, yeah. Let me read these out loud for everyone. We have some prompts for discussion. You may have brought your own comments, but just in case you need to think a little more about what you'd like to say, we have some questions to help. So our first is, what parts of the written report should we explain or support better where we need more information? What suggestions do you have for resources that should be included in the report? What examples would you like to share that might help support the findings, like your experiences or stories? Is there anything missing, or is there incorrect information? And how do you suggest that we update this information? And then just a general, what else would you like to share? Anything from the Colorado community is welcome in this space. Thank you for that, Carson.
Thank you, Mary. And I'm going to go ahead. This is Carson speaking. I'm going to go ahead and stop sharing so we can see everyone when they turn their videos on.
Sure. And this is Mary speaking. If you would like to speak, please feel free to raise your hand and I will call upon you. Thank you, Jill. Please feel free to unmute yourself.
Hi, everybody. My name's Jill Pidcock, and I am the Executive Director for the Arc of the Central Mountains in Representative Velasco's backyard. So I'm happy to be here. I was really taken by the statistic that that financially that was the biggest barrier, and the least barrier was getting people to sign up. When my experience is that really getting people to sign up, I mean, it's this perspective, right? So really getting people to sign up and register is tricky. And we've had challenges trying to get people to voluntarily put themselves in systems where they're not sure that they want to be put into systems voluntarily. And so I find that that is has been probably a much bigger barrier than, I mean, I'm sure money is too, but I was surprised to see how shockingly low that percentage point was on your findings, and keeping in mind of who you were working with and getting those findings from. That's just very telltale for me. And by the way, hi Reachwell, I use you all the time, and I think it's an amazing platform. Just a little plug for you.
This is Mary Angelica. Thank you so much, Jill, for those comments. And I think something else with our partner interviews and the responses we've gotten from open responses from the survey really show that all of those things are tied together, right? But it's very true with who we are surveying. I am unsurprised that funding is top of mind. I really appreciate your comment. Thank you. Robert,
I add on to that really quickly. This is Carson.
Yes, please, Carson. Thank you.
I think I totally agree, Jill, with what you were saying. And I think one of the things we heard was that outreach takes funding to do. And so that was maybe where part of that was coming from, was people definitely recognized that the opt-in amounts were low, but they just didn't have capacity to go out into the community and do a lot of outreach to get those opt-in rates higher. And so maybe that's also one explanation for that finding. Thank you.
Thank you, Carson. This is Mary Angelica again. Robert, I think I have you next up.
Okay, can you hear me?
I can
Okay.
hear you.
My test of my mic did not work when I first signed on, so I'm glad to know you can hear me.
Thank you.
Thank you for the opportunity to speak. My name is Robert Sett. I'm president of the Colorado Interpreters and Translators Association. We're a group known as CITA, C-I-T-A. And I'm also a board member of the American Translators Association. And I've been working as a professional translator and interpreter for nearly 35 years. And I'm a resident of Denver, Colorado, of course. So I wanted to make a comment today that language access for residents of Colorado is a crucial concern in many arenas, such as public education, the courts and the justice system, healthcare, and of course, public safety and emergency alert systems, as we're discussing today. As we've seen in natural disasters that have struck Colorado in recent years, minutes or even seconds may make the difference between life or death, or serious bodily injury, or the difference between the ability to save precious family documents, heirlooms, or beloved pets. For so many of our members of our communities, if English is not a primary language, access to accurate, timely, and quality messaging in the family's first language is critically important. And sometimes, as happens particularly in Denver, many households do not have a common language or a usual language like Spanish or German or French. Many of the languages represented in the Denver or Aurora Population Center are African languages or Middle Eastern languages, or what we refer to as languages of limited diffusion. And it's really important to include those languages in any language access policy or system that is developed, even though they may represent what seems like a tiny percentage of the overall state population. And as an additional comment, language access without quality language access is really not that helpful. As I know Representative Velasco is aware, requiring independent certification when it's available is very important. And I know many of her colleagues are aware of this as well. And also, as Carson mentioned, AI in the language industry, the language services industry, we are aware that it's not really a source of quality language access. ChatGPT, Google Translate, other services, these are not standalone services that are ready for prime time and ready to be used independently without human verification. So lastly, and I know in a sense I'm preaching to the choir here, but we don't want to force people with limited English proficiency to rely on friends, family members, or even their children to understand public safety messaging. That's not a sufficient or reliable solution to this problem, and I'm glad to see that the Colorado infrastructure or state legislature certainly and the government is aware of this and has created this initiative to recognize that issue and to set our great state on the path towards being more language inclusive in our approach to these critical public safety matters. In closing, I applaud Representative Velasco and the other state legislatures who have passed these measures in the legislature in both chambers, and the folks from the University of Colorado Boulder who are working on this program to make Colorado a more language inclusive state. As a representative of the translation and interpretation professions, I look forward to how I and my colleagues will be able to contribute to making this initiative into a concrete reality. Thank you for the opportunity to hear your plans and to speak today.
This is Mary Angelica. Thank you so much, Robert, for that feedback, and we will be reaching out to you, don't you worry. And just a point of note that in the field that we study, we often refer to tornadoes, hurricanes, winter storms as natural hazards, and disasters as being more human-made. So disasters really come from not having inclusive systems and not the nature itself. So thank you so much for pointing those things out today for us and for everyone here. You're very appreciated.
As a translator and terminology geek, I appreciate that correction and, and that revision of my comments, and I will make note of that and in future comments. Thank you so much.
Yes, this is Mary Angelica. That was not a correction, but just food for thought. Thank you so much.
Appreciate it. Thank you.
Thank you. Zuben, I believe you have your hand up next. Would you like to take the mic, please?
Hello, can you hear me? Wonderful. Hi, thank you for having me, Carson. Thank you for delivering this report. We very much appreciate it. And thank you, Representative Velasco, for making this a priority here in our state of Colorado. My name is Zuben Bastani. I am the founder of Reachwell. Reachwell is based here in Denver, Colorado. And for a little over 2 years, we have been delivering translated and accessible emergency notifications to counties within our state, counties including Larimer County, Boulder County, Eagle County, Gunnison, Pitkin, Delta, San Miguel, and El Paso is coming on board here soon with a few others. We've gotten a lot of feedback over these last 2 years around our systems and how we can continue to meet the needs of Coloradoans. We built Reachwell to be an inclusive and accessible alerting system, supporting school districts throughout the state, supporting nonprofits that serve migrant families across the state and newcomer families as well. My comments are really related to some of the findings. And if you know me and you know our team, we are very humble and we're all about trying to raise the tide to raise all ships. So a couple pieces of information that I think would be of benefit to the report would be to add some clarification around user selected languages. Some of our, well, all of our clients recognize that when messages are being delivered, they're being delivered to a set of languages that are believed to be used in a community. However, that is not always the actual languages that are being used in the community. Because of these learnings, we've designed our platform to allow users to choose their own language, and then we go back and advise our clients and our counties on what those languages are that are being selected in their county. So when their messages might be perceived to be there might be a perceived need to translate those messages in a few languages. The reality is that there's more of those languages that need to be translated. Secondly, I want to make sure we address opt-ins. Yeah, opt-ins are hard with these emergency notification systems. There are some tips that and lessons that we've learned. We applied to the design of our application to make opt-ins easier, to increase the adoption of these alerts. Some of those include addressing privacy issues, as there's high levels of distrust in government, there's undocumented families, and many of the existing opt-in tools require the sharing of a lot of personal identifiable information. Secondly, we want to make opt-ins easier by having lower technical requirements. So making sure that phone numbers, email addresses are not required, and that data does not have to be collected in order to deliver life-saving information. Also making sure that messages are not only translated into the languages, but that messages can be read to the families in the languages that they need, is another way to increase those opt-ins. Last point about the opt-ins that we've discovered as well is that when an agency is trying to drive opt-ins or trying to drive adoption of any sort of alerting system on their own, it's difficult, right? These are agencies, they have badges. There's a lot of distrust in government from documented, undocumented, migrant residents here in our state. So making sure that the agencies are partnered through a network of trusted messengers is a phenomenal way to rapidly capture opt-ins, like we're doing in Pitkin County, where we're connected with school systems and nonprofits to drive those emergency alert systems to members of those other communities. Last couple of pieces that I wanted to share, and then I'll hang up the mic, is regarding the standardization practices. There are maybe about a half a dozen that we know of emergency notification systems in practice here in Colorado today. They are all utilized differently. They all require different levels of training, and displacing those to adopt a single platform will be extremely difficult. However, there are options here to bring standardization and practices without requiring additional effort on those dispatch operators, where seconds equal lives. So ReachWell's developed a way to integrate all of these different systems to deliver accessible, inclusive alerts. And so looking to platforms that can integrate all of these different systems would be a recommended best practice up to the state. So I thank you so much for your time, and are here to always be a resource to the state to protect our families here.
This is Mary Angelica. Thank you, Zubin. It's nice to hear from you, and we really appreciate your comments. Carson, I don't know if you have anything to add to what Zubin has said.
Sure. I mean, thank you so much, Zubin, for sharing. And I think what our team discovered is just how complex the systems are here. And there's really no one answer that's going to solve all of the things, which I know you are totally aware of. And so I think it's going to require some creative problem solving and working with communities and really thinking about that. I know your group is doing a lot of that already. So I just want to say thank you for what you guys do and for sharing those thoughts with us.
Thank you.
Yes. Thank you again. This is Mary Angelica. Monica, I believe you have your hand raised. Would you like to
Yes.
come off mute?
Yes. Can you hear me?
Yes, ma'am, we can. Thank you.
Great. Thank you. This is Monica Weber. I'm with the Office of Disaster Management, and I'm a coordinator there. And I work primarily with our community preparedness component. So the portion that you all talked about, some of the outreach pieces that really resonate, some challenges there. But to share a couple of examples and just resources that we use ReachWell currently, and that's been a big help for us, as Zubin mentioned, of getting folks where there might be barriers in having to share personal information, because we see that quite a bit in our community, and that resistance or hesitancy to have to share and sign up. And then additionally, just in some of the consistency components, we have our dispatchers and communication centers be the folks that send alerts out, and that really helps from a consistency standpoint. They use the Maletti model for the language and just content that's used in the alerts, and I think that would be a great thing to see statewide, to have that kind of standardization, and then just also helps with the speeds because they've built templates out to be able to do that. And I think that's something we've partners of ours that work in the disability space, especially for folks that might need a little bit of extra time to mobilize, that time is super, super critical and getting things out at that warning phase in the model that we use. So I think there's that. And then another thing that we've done as a county is predetermined alerting areas, or polygons, as we call them internally. And I think that that's something that ties into the alerting systems, just because that allows for our first responders, as they're sizing things up in the field, to be able to much more quickly get that information out to our populations that need it, and potentially to allow more time for human eyes to review things if it's an incident type that does allow time for that review. So those are just a couple of comments there. I think the findings that you all have are really great too, and underscore the need that was already mentioned of having that funding to outreach, because I think that's where I see a big gap as well, is we can't get people to sign up if they don't know that a sign up process or even alerts exist in their community. And so really being able to put funding or staffing towards that. But thank you for this opportunity. That is all of my comments. But thank you for listening.
Thank you, Monica. This is Carson speaking. I just wanted to add on to your comment about the Maletti framework, which, just for those of you who may not be aware, Dennis Maletti was a disaster researcher and former director of the Natural Hazard Center. So he developed a model that basically includes all of these key components that should be in a message that will help people understand their risk and what they should do about it. And so that is included in the report. And also there's been a lot of work by Janine Sutton, Dr. Janine Sutton, or Jeanette Sutton, excuse me, in this space. And she's been working, her and her team have been working with FEMA, the Federal Emergency Management Agency, to develop a tool that basically allows emergency managers to go in and develop a message that contains all of those components. So that's not out yet, but it will be soon. And that's a resource that, that we do point to in one of the footnotes in the report, but just wanted to share that for folks on the call if they weren't aware of that.
Thank you, Carson. This is Mary Angelica again. We don't have anyone with their hand raised, and we don't have any written questions right now. So I was wondering, I recognize some familiar names in the participant list. I see you, Jennifer Kirkland, and I see you, Daryl. And I was wondering if either of you wanted to come off mute and maybe talk about specific 911 operations experiences, or if anybody has any experiences around visitors specifically. We have been talking a lot about signing up for apps, which is one situation if you live in Colorado, but unlike where I'm from, Missouri, no one comes there. A lot of people come to Colorado all the time. So I would also be curious if anyone has any feedback on visitor, any experiences with visitors. And I see you, Jennifer. Hello, how are you?
Good evening, everybody. This is Jennifer. Thanks so much. And I just first want to compliment you and your team on a really well drafted report. I was really impressed with the breadth and the depth. So thank you for that. in terms of 911, I specifically felt like you captured the challenges that 911 centers have in putting out alerts, and especially accessible and inclusive alerts. Not every 911 center or emergency management team has pre-built alerts. Those can help when those minutes count. So that's a best practice. I think that your recommendation for training on building inclusive alerts is excellent, but I think recognizing that the 911 center is sometimes the best place for those alerts to go out, but not always the best place for those alerts to be built, especially when they are fielding the calls still and fielding other calls that have nothing to do with the emergency event. It becomes very challenging to put any alert out at all. I think you're finding that the different platforms and alerting platforms and their sometimes limitations in building inclusive alerts. I worked with Everbridge for years trying to get them to build better language inclusive options into their platforms, and they were responsive, but it's also a large platform that they have to sell at the same time. So I get that there's challenges. And I think the more that states do these kinds of things, the more responsive they'll be. As far as visitors go, having previously worked in both Eagle County and in Mesa County, where there's a large tourist population on a regular basis, it is definitely a challenge to try and reach visitors. And your comments about people's reluctance to use WIAs are spot on. They don't have a great boundary. They don't, and it's scary to use it because you know that it's going through IPAWS, and if you mess it up, then they're going to come after you, not in a like terrible way, but there's going to be someone who will have questions for you. So I think that Colorado continues to be a leader in trying to find ways to reach visitors to the area. And I think that more outreach, not only certainly to our communities, but also with hotel and hospitality industries, points of entry such as airports, train stations, bus stations, and other ways to reach out specifically to visitors to say, hey, if you need emergency information, here's where you can get it. All of that I think would be helpful to have in your report. And thank you for the opportunity to add some comments.
Thank you so much. This is Mary Angelica. Thank you so much, Jennifer. And Jennifer has been such a rock star in helping us understand this entire system and getting listservs out and just being incredible. Thank you, Jennifer, for all you do. We really appreciate it.
It was a privilege to help. Thank you.
Thank you. Chris, I see you have your hand raised. Would you like to come off mute?
Yes, thank you. Chris Stewart, I'm the Delta County Emergency Manager. And just like Jennifer, I'd like to echo the great work that your team has done on this report. It's very thorough. You've done a good job of examining not only the research studies, but talking to the practitioners in the field of 911 emergency management who's actually doing these alerts. So thank you for a well-rounded report. Talking about some things to add, I think it would be good if you could get out in the field and actually visit some 911 centers and emergency managers, especially do a mix of urban and rural areas, because downtown Denver and their 911 center is going to be completely different than Delta County over here, or down in the San Luis Valley, or down with the tribes in Cortez or something. The resources and all the different hats that dispatchers and emergency managers in rural areas are wearing in the middle of a disaster response would give you a more rounded appreciation for alerts, I think. Another thing that we deal with as emergency managers, and I don't think was addressed in the report, is the public perception of how emergency alerts work, I think is a big challenge for us. They think that the alerts like follow them everywhere they go. Well, I got a cell phone and I got GPS location on my device, that it's like a location service, and that if I'm at the mall, it automatically knows I'm at the mall, and that's where I'm going to get the alert. And it's these opt-in systems rely on a registered address. And if that address falls within the polygon, then you get the alert. But if you're not within that polygon, you don't get the alert. So how we convey that to the public is a major challenge, especially in rural areas. And we can't use iPOS for every shelter in place, gas leak, anything that we'd use an emergency alert system for. Especially in rural areas, a challenge with iPOS has been bleed over. I think that was mentioned in your report. We used iPOS for a fire in Ouray County, which is here in the same region that I'm in. The standard that FEMA is shooting for is like no more than a 1/4 mile bleed over. And it was like 10-mile bleed over for people that got the alert. There was people in San Miguel County all the way down the city of Montrose that got the alert instead of people just in the Ouray area. Also during COVID, one of the counties north of I-70, I believe it was Routt County, had put out an EAS message over radio for the stay-at-home order. We got that in Delta County and Gunnison County because on the western slope, there's only a handful of radio stations that cover the entire western side of the state. So when you activate EAS, which takes over radio stations, you're broadcasting to not only your county, but potentially the entire half of the state, and maybe even into Utah. So that's also a consideration. That's why the big red button, and it's real concern of emergency managers of utilizing iPOS for systems like that. For visitors, here in the West region, we have Genesis, and they do have the ability to do sign-up codes and QR codes and stuff for visitors that they can opt in for a defined period of time. And then once they leave, if it's for a big event or they're just here on vacation. So we're still trying to work through how we could best set that up. Obviously, a WIA alert is the best way to reach everyone in a true emergency, life or death. But again, the concern of bleed over is a concern here in Western Colorado. And then one final point, just one thing that they don't seem to offer with these alert systems is like a test environment. So dispatchers, especially in rural areas, we don't do these alerts every day. And thankfully, we don't do them every day. So keeping the proficiency, how do you build an alert? How do you send it? They lose that skill. So being able to have a test environment to actually send these out would be a huge benefit to agencies. iPOS has something that we have to do monthly proficiency tests, but the general alert providers don't offer that. So overall, thank you again for a good report and happy to provide feedback.
Thank you, Chris. This is Mary Angelica speaking again. I have a couple comments to read in the chat, but before we do that, Carson, would you mind coming off mute, telling everyone what iPOS stands for?
Yes.
And also maybe going over a little bit of our conversation we had with Justin Singer, who is at iPOS National.
Yes, so iPOS stands for the Integrated Public Alert and Warning System, and it was developed through FEMA and available, I think, starting in 2012. And it's basic, as far as I understand it, it consolidates alerts basically so that you can send out alerts through multiple channels at once. This includes the wireless emergency alerts, also known as WIAs, which are the ones that go out to cell phones through cell towers. Also the emergency alert system, or EAS, and those go out through broadcast television and radio, as well as through many, many other channels. So that's what Chris was referencing. Additionally, yeah, Mary mentioned that we spoke with Justin, who works for iPOS, and he mentioned that regarding the bleed over issues, that there's some new tech upgrades coming online, I think in 2024, even in January of 2024, I'll have to double check, that we're gonna reduce that, at least start to reduce those issues. And so it's gonna get tighter. And so he was saying that with technology updates, it's gonna get better. But yeah, there's definitely a lot of issues. And I'm sure many of you got the alert on October 4th. So that was a WEA message that went out across the US, so wireless emergency alert message. And our team did a little tiny study of folks at the Natural Hazard Center. And we had some people put their alert in Spanish or set it in Spanish on their phone. Some people set it in English to see what we received. And there was a wide array of the types of information people were getting. Some got it only in English, some got it in Spanish and English, some got it in Spanish, even though they were set to English. And so there's a lot of tech issues just that are preventing that, but it takes a really long time for the Federal Communications Commission to make changes. And there's also a lot of pushback from cell phone companies because they're the ones that are really having to update their systems to be compatible with this. So yeah, thank you for sharing that.
This is Mary Angelica. Thank you, Carson. We do have a few comments in the chat that I will read out with our last remaining 5 minutes. And if we have some time, maybe we can respond to some of them. Nadia said for recommendations of the people portion of the report, the first suggestion is to hire state level personnel to address language access needs. 2 questions. 1, how would the state level standards be determined? And 2, what can smaller translations and interpreter agencies do to meet those standards when training and education with training and education for potential hires? Heather said, I also believe that trusted community members could help educate communities that this would help them, that they are here, that they're here for their communities. For our Spanish interpreters, I also received a comment in Spanish. So if you could switch over to the English channel and I will read the comment in Spanish. So give me a thumbs up when you're ready. That's what you mean. Okay. So, invertir en recursos humanos, como también en entrenar a promotoras CHW, navegadores y líderes bilingües pueden jugar un rol importante para enseñar de una manera culturalmente conveniente a grupos en su comunidad. Las vías educativas pueden ser un buen medio para que estas promotoras pueden demostrar cómo bajar estas aplicaciones o suscribirse, manejar las alertas y ayudarles a navegar en estos sistemas. Las barreras tecnológicas en la comunidad latina, en especial en áreas remotas y rurales, es un gran desafío. Esto es de suma importancia y necesitamos crear estos hábitos de alertas y demostrar que son beneficios vitales. All right. Thank you for that comment, Heather. And just from reading that, we have read a lot in our literature about promotoras, which are community leaders that provide I guess, community communication during emergencies, which comes from the public health background. But thank you so much for that comment. That's one of the things that we are looking for. And also, David has said the National Weather Service is another trusted partner and resource for warning and notifications. The NWS, National Weather Service, can launch a host of notifications, including use of weather radio and transmissions. Thank you all so much for your comments in the chat. We have just a couple more minutes, so if anybody wants to raise their hand last minute, I'll wait 10 seconds. This is almost perfectly on time. Carson, would you like to close us out for this evening?
Sure. This is Carson speaking. Thank you so much, Mary, for leading that session, and thank you to everybody who shared tonight. I know we didn't hear from everyone, so if others on the call want to share anything else, we would really love to hear your thoughts and comments. We will be spending next week incorporating all of these in the final report. So I want to again close with thanks just to everyone who is here tonight. Thank you for taking your time to be here in the evening to provide comment on this important topic. I also want to give a huge thank you to our interpreters, both the American Sign Language and Spanish interpreters that we had here tonight. We're so grateful for you all for being here. And I also want to say thank you to the dozens of individuals who made this research possible. Special thanks to Representative Velasco, Mickey Trost, Jennifer Kirkland, Gary Breeze, and Cheryl Garcia, who provided a lot of project support and guidance, as well as the Natural Hazard Center staff for providing review and assistance throughout, and the emergency response personnel of Colorado who gave their limited time to respond to our survey and have spent their lives in the service to their communities. And I also want to say a huge thank you to Mary and Melissa, who I could not have done this without. They've been just such a rock star team to work with, and we've really enjoyed learning so much about emergency alerts here in Colorado, and we hope we can continue to do more research in this space. So thank you all for being here, and we will be sending an email after this with some additional links and information to our project page where more information will be posted. The recording from tonight will also be posted, and then there'll be some other information in there as well. So thank you so much, and please reach out if you have any questions or comments after this meeting. Thank you.